This morning on Summer Spotlight, we're out of the studio in the parking lot. It's starting to feel a little bit full here this Tuesday morning. We have the St. Joseph Health System's mobile medical unit here on site at ABC 57 News because I wanted to give you that firsthand look. And now the second bus in circulation, helping to bring you that one-on-one care to the community right to your front doorstep. But really, where did the idea for this one get started? I know I bring some crazy stuff here to ABC 57 at times, but this one I just felt it was so useful. It is bringing you that on-care site to your doorstep, everything that you need that you may not be able to get out to for those typical doctor visits. And joining me this morning from St. Joe Med Health Systems, we've got Latoria Green. Thank you so much for making the trip.
Thank you for having us here.
Well, this is a fun day. How often do you get to come to a news station with the mobile medical unit?
No, it's a mouthful, isn't it? But so excited, and thank you so much for being able to highlight our second unit that we have, where we're able to do exactly what you said, bringing healthcare out to the community, whether it's at businesses, at community organizations, really bringing healthcare and providing that access for our patients.
And I love that this is now the second. The first one worked so well that we're doing two. Can you tell me some of the differences between the two?
So our first one is our on-site mammogram. So that is our first mobile medical unit. So you got me. So our second one is really doing those typical office visits. So immunizations, blood pressure screenings. We can even do our social needs screenings as well too on this unit. So really tapping into our community health workers that we have as well. And so it provides us to have additional resources and additional services that we can actually provide to our patients.
And of course, I love giving you guys that hands-on interactive experience. And can we do that for them too, Latoria?
Yes, definitely.
Let's go inside Michiana. So this is the beautiful mobile medical unit. It's got a nice little awning outside, keeps everybody nice and protected. And you can see over here, this is an ADA compliant door. So for anybody that needs that wheelchair access, you are able to do that here on site. So, okay, we walk in, and first things first, kind of little baby greeting area.
Yes, definitely. Nice welcome reception area that's here where we can do a lot of our registration. We have an exam room that's right here, right behind our cab. And then we have an additional exam room that's right back in here. We also have the wheelchair lift. So, like, if we have any patients who, have accessibility issues, we definitely have that's available for them. So it's really big and spacious, right?
I mean, you can literally just pop right on up.
Yep.
And I'm ready for my exam.
Exactly. We can take your temperature. Like I said, blood pressure screenings can be done. So immunizations, those typical office visits is something that we can definitely do.
And a question that I had coming in is I feel like going to the doctor's office has become such a foreign thing.
Yes.
Especially since the pandemic happened.
Yes, definitely.
Now, we're through that hump, hopefully. My fingers are still crossed. But have you seen that kind of medical need change, and is that kind of where the bus came in, or how did the idea for a mobile unit?
Because we really want to make sure that we're accessible. That's key, the key for this. And so we want to make sure that for those patients who may not have been to the doctor for whatever reason, may have been the pandemic, may be in transportation issues. So how do we bring it to them? But then also how to connect them if they already have a primary care provider and they maybe, like I said, haven't been into their office. How can we reconnect them with their provider? Or even just helping patients who may not have a doctor. How can we help them out to be able to provide that on-site care for them?
And it was nice you mentioned to me a little bit that this is kind of specifically geared towards a lot of our rural communities. Is that where you're seeing the most need right now?
Definitely. Again, transportation is a major issue for a lot of our patients not being able to attend their appointments. And so this just becomes a great opportunity. We can bring it right directly on site, whether it be at a doctor's office, or we can go to a community center, or we can even come to businesses to be able to provide these services. So, don't have to even take off of work, to be able to do it. So it's definitely a great thing to be able to provide that accessibility.
And how are you trying to provide that? Are you saying, hey, come out to this spot this time, and what's our next date that we have to figure out?
Oh, yeah. So our whole thing, we'll be kicking it off in the fall. And so we'll have, some different sites and working, like I said, with businesses and community organizations for sure. I definitely want to shout out with our partnership that we've had with great support from First Source Bank for this mobile unit as well. Definitely with their partnership, we know that it definitely probably wouldn't have been possible. So we're very excited to be able to have that partnership as well. And you'll see their logo on the unit too.
Yeah, so First Source Bank, thank you so much for making this all possible too. And Latoria, I wanted to head back this way a little bit because when you're done with your exam, You come back out. How long are these interactions usually, these office visits?
Yeah, so you're probably talking about maybe good 20, 30 minutes in there. And, you know, really it's based on the patient and what their needs are, especially as we're doing those social screenings that we might find out there's some other needs that our patient may have. You know, we may be able to refer them to other resources as well, too. So case in point, our diabetes prevention program to really help with that healthy lifestyle living. Also letting you know about our other mobile unit that does the mammograms on site, but then also other needs that they may have, whether it be housing, food needs, whatever need it is that they have, we try to make sure that we help them. So that might take a little bit more extra time, but it's extra time that's definitely worth spent.
Well, I can tell that the care and love is here. Latoria, thank you so much for your time in Michiana. We'll be right back after this.